Good afternoon, everybody. Thanks for joining us this afternoon. This is my third and final, I guess second to last, maybe of all the presentations happening these last couple of weeks. So thanks to all of you who have signed in. My name is Lynn Braun. I'm the Director of Counseling Center here at SUNY Oswego. I'm also President-elect of the Association for University and College Counseling Center Directors. It's the kind of international organization for folks who direct counseling centers in colleges and universities. So very happy to be here today to talk about the impact of trauma and bias or discrimination on learning and coping. And so I'm going to share my screen with you. Let's get that started. There we are. And so give me just a minute. I'm going to pull up. Wait a minute. Wrong screen. That did not share right.
We're seeing
Okay.
it.
Can everybody see it? Sorry,
Yeah.
it popped up in a weird spot for me, so I want to make sure we have the right screen up. I have multiple screens sitting here in my office, so it's always I always want to make sure I've got the right one. And I have my chat up too, so I can see what's happening there. Let me hit one more button so I can see everybody. There we are. So we're gonna to this is a topic. I mean, I very much enjoyed all three of the topics that I've been doing here as part of this series, but this is one that I don't get to talk about a lot that is really near and dear to me. So I was really thrilled to be able to have some conversation with you all about it. And so I think I've done this at every presentation that I've given so far. So I'm going to ask briefly here if folks want to unmute or write in the chat. What is it that either drew you to coming to this presentation today, or what are you hoping really that we talk about today, so that as I walk through, I can help make sure that we cover some of that information. Any thoughts that folks had as they were getting ready to join us?
I'll share that I've had, a handful of students over the years share some concerns about bias related interactions that they've had, and both on and off campus. And I've definitely brought students over to the counseling center before to kind of engage in some conversations on that. But I'd like to know, I think, a little more broadly, what I suppose what the protocol is when those kind of incidents come up, because I think we hear a lot about Title IX and how to navigate the protocols related to disclosure of violence and things like that, which also I've had students disclose things related to that as well. But I've sort of found myself at a loss of who to contact and how to how to best handle those situations. Sure. And so
no, thanks for that. We will definitely talk about that a little bit, especially toward the end.
Great.
So Lynn,
other things? Yeah,
Ramin here. So we lose students when these things happen to them. So we need to understand the parameters of what they're dealing with better. Mm-hmm. And we need to do a better job in supporting them so that they can succeed. Mm-hmm. So I think that's the primary reason I'm here.
I appreciate that. And when we lose them, we compound issues for them too, right? Because the not being successful adds to some of what's happening too for them, to them psychologically. I'm reading, Alyssa, your message. I almost forgot to look over at the chat, but thanks for that. Okay, how we can assist partners overseas in supporting students. Hopefully we will cover some of that for us too here today. My primary kind of interest or focus is we're going to start talk some about the mental health aspects of this for sure, but we're going to really focus more on the academic performance parts of this and why. What is it about these issues that puts folks at risk for struggling academically? Yes, and emotionally as well, and then start to figure out how do we start to do some things to help mitigate those factors for folks. And so we're going to talk a little bit first in general about the impact of stressors on learning. And if you've attended any of my other sessions, you've seen this next slide, because it's one of my favorites. But the reality is, right, for any of us at any given day, what we would call our best changes, right? And it changes based on lots of factors. So I kind of describe it really as an issue of bandwidth. So we all have a certain amount of capacity, right, every day to manage. And when we wake up in the morning, there's a certain amount of that capacity that's already taken. It's taken about worry over finances maybe today, or it's taken over worries about an argument I had with a family member or close person close to me that I'm still thinking about or dealing with. It's taken up with worries about something that's coming up in my day. It's also taken up by things that have happened to me that I haven't dealt with, right? I mean, so everybody has a certain amount of bandwidth every day that's already gone when you wake up. And then as things happen during the day, other pieces of it get taken. And so whatever bandwidth is left is what I have capacity for, right? To learn, attend, engage. And what part of what we have to recognize is that sometimes for a lot of us at times, but for sure for lots of our students, they are walking around with a lot of their bandwidth already taken. And so when you have students who are struggling to focus, attend, perform, one of the things I hope we start to pull out of today is that those are generally symptoms of something else, right? And it's a sign often that what is consuming them is taking up a lot of room, which means they don't have a lot of bandwidth to focus on the stuff that they need to focus on if they're going to be successful academically, or if they're going to be even successful socially right on campus in what it means to live and learn in a campus environment. So as a general framework, that's a big, I think, part of this to start to maybe think about. From a trauma perspective, I think we need to talk for a couple minutes about what those things actually are. And I know that on Wednesday, if you attended my presentation, then we started to have a little conversation about this, and we talked about the crisis narrative. We've talked about it a little bit. We did de-escalation last week, but to really just look at what these words really mean, right? A crisis is a person's perception or experience of event that makes it intolerable, right? Difficult to manage and exceeds resources. If it's exceeding my personal resources, I'm probably going to be in crisis. Now there are other things that happen that, yes, I can manage, but that are really difficult, by the way. So it's not to negate those, but it falls into a crisis moment when I don't have the resources to navigate it or deal with it. We then go in, and feel free, by the way, if you have questions or thoughts, to either raise your hand in the chat or unmute or pop them over there and pop me a question as we go. If we look at what trauma is bigger than that. So when you deal with a traumatic event, you're dealing with a situation that, yes, is distressing and overwhelm your ability to cope, but it also creates traumas create a state internally that says to your system that your system is at physical and psychological risk, like of death, right? I mean, the traumatic events are events that have your system responding in a way because it feels threatened to a point that it might not survive. Okay, and that creates a lot of things. How far and how long we're stretched often also predicts whether something's going to end up being traumatic. So how severe and how long it lasts can be a mitigating factor, though you can have a very short-term event that is also traumatic, right? So it's not like it has to last a long time to be traumatic, but that traumatic events create a neurobiological change in our brain because our system feels threatened at a level. And so not only does it biologically change our brain, but it also creates some automatic reactions. And those are reactions I think probably that most people will be familiar with when I put them up. But when you experience a traumatic moment, your system picks one of these three things, right? Fight, flight, or freeze. And what's important to note about trauma of all kinds is that you don't get to pick which one of those occurs. Your brain picks for you as a survival skill, right? And so it's why for lots of folks, for folks who are survivors of sexual trauma, we see it in combat veterans and law enforcement folks. Freeze is the one that if you ask everybody ahead of time, nobody thinks their brain will pick, and yet it is one that gets picked a lot. You know, you see a lot of people describe freezing. And it's why a lot of people in the aftermath of a traumatic event feel really bad and have a lot of shame and upsetness, right? Because they feel like they didn't do anything, when in reality is they didn't pick, right? Their brain picked for them that was the way to survive a moment. And so just as a framework, I think it's just important to talk about what trauma really is. So that any questions about that as we move forward? Okay. So let's talk just a little about trauma prevalence, just to provide some data. I'm going to give you some data from the Collegiate Center for Mental Health, and that's a database actually that we as a center also add information to, and they really compile data from college counseling centers across the country who are members of CCMH, and they have a very wide-reaching membership. And so their data is looking at the population of students who access counseling services, okay? And we're going to look at some general population data too for campuses, but CCMH in particular is looking at folks who access counseling services. And part of what they have seen in the last 10 years is that a history of past trauma has passed prior counseling experience as a mental health history item with the largest increase. So we are seeing more and more and more students. I think that all of you who are working with students who've been in higher ed for the last decade have seen this exact same trend, right? We are seeing more and more students coming who are reporting and experiencing a history of trauma. When you look at this data, in particularly from CCMH, it's childhood emotional abuse and sexual violence that's accounting for the majority of that increase. And that reporting of traumatic experiences has increased every year in the last decade. And now we've got over a quarter of students reporting unwanted sexual contacts or experiences, and 40% are reporting experiencing some type of harassing, controlling, or abusive behavior, right? So these are pervasive things. Now, this is only one, sexual violence is only one kind of traumatic event, right? I mean, there are lots of kinds of traumas. But if you're looking at it in this way, and that would be consistent, I would say, with national statistics. If you look at statistics on sexual assault that really haven't changed in the last few decades, sadly, about a quarter of women experience some form of sexual assault before the end of their freshman year, right, in their lifetime, and by the time they graduate, it's about a third. And so, this data, I would say, is very much on point with some of those other national data points that we've seen. Almost half of folks have experienced a traumatic event that have caused them to feel intense fear, helplessness, or horror, right? This is a lot of folks who are experiencing things. Yes, this is a clinical population, right? Folks who are accessing counseling services. I can tell you just from my experience, I'm still learning more about SUNY Oswego's general campus population, but I can tell you from the decade I spent at my small private little liberal arts college in Northwest Ohio, we've really found that what we were seeing in the center was pretty representative of what was happening in the population. Just there were a lot of people not seeking service. So those numbers may be a little lower in the general population, but they're not drastically lower, right? There are a lot of folks walking around who have experienced, a lot of really hurtful things that they're trying to figure out how to manage. And a third of folks have experienced more than one. So we also have folks who have multiple traumas and or chronic, right, ongoing traumas. So that have impacted them. And a third of them were in the last year, and about 75% were in the last 5. I will say though, I don't know that that's as relevant. Having I'm a person who has adopted children from foster care, and I know one of my kids has his trauma comes from age 2, so way more than 5 years ago, but it's just as impactful now for him really as it was then. So I don't know that how long ago it happened always matters, but there's just some data there. Okay, so how does it impact learning? Clearly, we know there are mental health outcomes there that I don't think would surprise anybody. I'm not going to focus there. I'm going to focus more on the learning side of it. If you look at the data around trauma and learning, it absolutely impacts attention, memory, organization, comprehension, and trust, right? So for lots of reasons. Folks who have experienced traumatic things often have some levels of hypervigilance, right? Often they are more alert and aware of what's happening around them, partly from a self-preservation standpoint. If my body is doing that, it's hard to focus on what somebody's saying all the time, you know. It's why some folks position themselves certain places in rooms, right, to put them in a place that feels more secure for whatever reason for them. It can impact memory issues, right, because their brain is also consumed with dealing with whatever these traumatic things are, whatever the thoughts and feelings they're having. And absolutely, I think we can all understand why it impacts their ability to trust certain people, right, in certain circumstances. We are also seeing kind of in that, and along with that, this reduced ability to focus, organize, and remember information, kind of as we said it. And then to produce the work, right? So, it is academic performance problems. I'll probably say this multiple times as we talk today, are a symptom of a problem for most people. Most people are not having academic performance problems just because they're lazy or don't care or any of those things. There's generally something happening that is getting in the way, right, of them being able to perform. And so our ability to produce work, I have a student I worked with a few years ago at my other institution who it would take her 3 times as long as her fellow classmates to complete assignments at night. Because and she has a really extensive trauma history, and so because of all the other things she was managing, her ability to stop and focus on this assignment was extremely, extremely difficult. It's why, and part of the reason why we have to recognize these things and sometimes get them to us at the center, is that for some of these students and some of these things, some of these things are things we should be providing some accommodation for as well, right? If it's diagnosable and recognizable. So that's another thing to be thinking about for some of these folks who are having a lot of memory and focus issues. There are not only therapeutic things we can do to improve it, but there are ways we can provide other support on campus to help mitigate some of that for them. It absolutely interferes with problem solving and planning. And that's for a lot of reasons, right? You will see some folks who come from home environments or communities where they often felt unsafe. And in many cases for those folks experience several traumatic things. That feeling unsafe and kind of living in what some of them would say to me is kind of a survival mode makes it very hard to know how to plan because their lives have never been very planned, right? They don't have a practice of planning. They're used to responding to what's happening around them. So they have a very external locus of control. They're not used to being able just to control themselves and have that, be super helpful to them in the world. They're used to always being kind of on alert. And so just another example, right, of how some of these issues can impact learning. And absolutely, they're going to get more frustrated and more anxious. Partly because when things get more difficult, the fact that it's harder for them to get something done than the peers around them is frustrating, but also just the acknowledgement and realization, right? That these things that happen to them that they never asked for are now making their ability to succeed harder is also frustrating and anxiety provoking for them. So it happens on many levels. It gets in the way of their development for sure and their communication skills. And so they're not only is it happening, they're not always great at wanting to talk about it, which again, I think we can completely understand, but also in knowing how sometimes to communicate when they're struggling or when they need something. And especially if they've not been used to having needs met, they don't even know to ask, right? They don't even know to communicate. If they're used to being on their own and managing these things, they feel like they have to be on their own and manage. And that can be a factor as well. Excuse me. Sorry about that. It can get in the way of understanding and grasping the cause and effect of relationships. So they can sometimes respond in a way that causes a rift or a problem, right, with you as a faculty person or staff person or with another friend of theirs, and they don't always even understand the back and forth that's gotten there. Again, because they're pretty used to just reacting often, especially if they're still really struggling with managing some of those feelings. So that can be difficult for them. And clearly, I think we can all understand that it's going to impact their overall sense of self, right? And it makes it difficult to feel motivated, proud, or engaged because they're trying to also recover, right? And the part of the recovery and what's happened to folks when they experience traumatic things often has them feel the opposite of those three things. Questions or thoughts about any of that? Okay. We also see this phenomena a lot. And I think you all see it probably in your offices and when you deal with those, we see it sometimes the folks that walk in here for a walk-in, even sometimes, you know, who need to see somebody in an emergent way. If I'm carrying a lot of things and I have a lot of bandwidth taken, right, as we talked at the beginning, it doesn't take a lot sometimes for me to be pushed over the edge, right? And so often we see these circumstances where something little, what we see as little happens to somebody and they are, you know, and they end up in crisis, right? And are kind of emotionally falling apart and we can't understand what that is. And oftentimes people have not a ton of empathy really if that's happening a lot, right, for a person because they just seem like every little thing is sending them into a tailspin. And what I would say is that's kind of true, but what's really probably happening, right, is what this image really is trying to show, that's a symptom that their bandwidth is largely taken in some capacity because it would not be typical for something little to send folks, right, completely over. So if that's happening to someone on a regular basis, that's a sign something's going on that we need to be paying attention to. Thoughts or questions about any of that stuff on the trauma side of things? We're going to kind of talk, we're going to shift gears now and talk a little more about bias discrimination and in particular what stereotype threat. And then at the end, we'll kind of wrap up and talk about how we work on mitigating all of these things kind of together. I'm very curious as we head into this, if anybody is familiar with stereotype threat. Is anybody familiar with that as a concept or term? I see a couple head shakes there. I find not a lot of people have, so I was really curious if that's something that folks have thought about. So we're going to talk a little about what it is here in a couple minutes. But hopefully I think the stereotype threat is a really important concept when we're looking at learning environments and trying to understand how bias and discrimination impact the learning process for folks. Some stats again, looking just at overall areas of discrimination. Healthy Mind Survey, which is a population survey that comes out of the University of Michigan and the Healthy Minds Network that looks at the college student population as a whole. Between 2007 and 2023, in any given year, between a quarter and a third of students report experiencing discrimination in the past year. If you look at non-white students, that jumps to about 40% or sometimes more in any of those given years. If you look at the association, the American College Health Association, sorry, ACHA, their national data, they have found that about a third of folks who would identify as non-cisgendered report discrimination in the last year. Of them, 97% report distress as a result of that discrimination, and 30% of those folks reported impact to their academic performance. Okay. Same data set, 20% of students who reported the ACHA survey, this would have been, I think, the 2022 survey is the last monograph I could find. 20% of students experience microaggressions, of students who experience microaggressions, sorry, report that it's negatively impacting their academic performance, and 30% of students experiencing discrimination as a whole report it's negatively impacting their academic performance. So, you know, if again, kind of to Ramin's point early on, you know, if we want students to persist to graduation, primarily for their sake, first of all, to be able to complete their degree, and then as a subsequent for our sake, as an institution, these factors become really important. You start adding these percentages up, right? You start looking at them in a student population, those numbers start to increase dramatically, and we can start to identify. Back to CCMH data, which is, again, counseling center, folks who access counseling centers. 20% of student clients report discrimination related to at least one identity in the last 6 months. The students who report that also report more distress in all areas. So basically, part of what we give, part of what we administer to all students is something called the CCAPS. It's an instrument that helps show levels of distress on lots of different factors, including anxiety, depression, social anxiety, eating concerns, academic stress, and a host of other things. And on each of those individual items that I just mentioned, if you've experienced discrimination, you experience higher levels of distress on all those indicators, if that makes sense. So for folks on depression, on the depression scale, if you have not experienced discrimination as a whole, those folks score lower in the distress leader, as less depressed as folks who have reported some type of discrimination. And we find that true for all the scales except for alcohol use. So on academic stress, if you're experiencing discrimination, you are experiencing higher levels of academic distress as well. And so that's a really important factor, I think, to note. And generalized anxiety, frustration, and anger and depression see the largest increases. There's the largest difference between folks who have and haven't experienced discrimination. I will say that CCMH in their monograph that's getting ready to come out, it's supposed to come out at the end of January, they have done a much deeper dive into their research on bias and have some really interesting findings that will be coming out that they previewed for me at us at our national conference of counseling center directors in October, but the monograph's not out and I don't have the actual data, so I didn't post any of it now, but that will be coming. There's some really interesting things there to inform us about mental health concerns and the connection to bias and discrimination incidents. And I think, as we could probably assume, but they have found to be true, discrimination in more areas corresponds to higher distress, right? So the more areas that you feel like you're being discriminated against, the more distress you experience. And I think that makes sense probably to most of us. So there's some data points. I think that it's important to just note overall that a lot of what we're going to be talking about is, yes, we're going to be talking about being discriminated against and biased, but there is a part of this that is about the psychological weight of being when you are not like everybody else around you. And that the psychological weight of being an only, right, or a one of a few is a weight that folks experience. And I think that we have to recognize that as we get into talking about stereotype threat in particular. We start to think about how we can help mitigate that in various ways. It's very interesting. I have, as I said, I think a minute ago, my children are adopted and they're biracial. And this is the first, since moving here, this is the first school system they've been in where most people don't look like them. And it's been really painful on one level, and it's been interesting on another to watch their realization on the weight of being that they have not really experienced before, because they are used to having more people that look like them, and now that they don't, they are feeling the weight of what that means, even in simple things like Black History Month, and what happens when they start to talk about Black History Month and how everybody looks at them. You know, I mean, the various things that happen, right? And I know those aren't things that are even trying to be mean or hurtful or discriminating, right? But just the focal point of that and the weight that brings and the impact that has on them in a classroom is fascinating and, you know, and sad, and something that we are continually working to try to mitigate. So we have to recognize that bias impacts the learning both from a professor's point of view, right, or staff's point of view, and from a student's point of view. And so we're going to talk about it kind of from both angles in some ways today. The first one really is implicit bias, right? We have to recognize that we all come in with unconscious attitudes and stereotypes that we have learned culturally. Then they say we asked for them, but we have all learned them. And then it's part of how our brain has made decisions to be efficient, right? That's the implicit bias is all these unconscious attitudes and stereotypes. Peggy McIntosh will talk about it as the programming that we all get. She does a lot of work on white privilege. That, you know, it's not like we asked for it, but we all get it. And it doesn't matter what race, gender, sexual identity you are, we all have it. We all have the programming because of growing up in the culture that we grow up in. And that bias, right, from a professor's point of view, from an educator's point of view, for folks, what we know is it's linked to excessive discipline for some groups more than others. It is linked to lower academic expectations of some groups than others. It's linked to overcritical grading procedures, we know, for some groups than others. Sometimes that's conscious, but in most times it's not, right? These are unconscious things that happen. If I'm the only person that looks like me in a room, my behavior gets noticed more than everybody else's. Unless, right, unless that instructor is conscious of the fact that that's likely to happen and is working to negate that fact, right? That Peggy McIntosh would say that, you know, we insert alternative programming. It's like inserting an extra disk right into our computer that negates that programming, right, in those moments, and that takes intention and energy to do, and to fight. And if left unchecked, it impacts the things that we either focus on or don't, and expect from a student or don't. And so, you know, one of the first things you'll see in the recommendations here that we get to in a little bit is, what do? Part of it is we have to know us, right? And we have to have an awareness of who we are and where our implicit biases are and how they're playing out. And that's through our own self-exploration. There's a ton of great resources on privilege and other ways of kind of doing that for ourselves. And it's talking to and working with folks around us, right? And getting feedback and hearing that feedback as we work through that. Any questions about this little area on implicit bias? Okay, don't see any. We're going to shift on to stereotype threat. And again, this is thankfully something some of you have heard about, but I find that a lot of people haven't heard about, unfortunately. And so here's what stereotype threat is. It occurs when there's an opportunity or a perceived opportunity for an individual either to confirm a stereotype about a group to which they're a member. Okay, so it's not always conscious, by the way. Sometimes it is, but it's not always. But if I'm in a situation and I identify as a member of a group that has a negative stereotype, and I think I'm going to have an opportunity to confirm that, it impacts my performance, is what we have found. And so that threat of possibly confirming the stereotype gets in the way of me being able to perform. And what they're really finding is it's diverting mental resources away from the task and onto the worry or the stress, right, of potentially confirming whatever that stereotype is. Again, sometimes consciously, but oftentimes not consciously. So here are some very interesting examples of stereotype threat that come from some studies that I've looked at and read about. And these are just a few. The first is a study they did they took some white students and African American students out and they had them play miniature golf. Okay, and the first time that they or the first group they had play, they said that they were playing to measure athletic ability, and then they played. What they found in that instance is that the African American students performed better than white students. Why? Because the cultural stereotype is that African American individuals are better athletes. They have better ability. I have this complete debate with my 14-year-old all the time, about whether that's really true or not. What's fascinating is they then took a group and said, we're going to study sports strategic intelligence. And they found the opposite effect. That when you were going to measure intelligence, white students, white golfers in that study did better. And they saw underperformance of African American students. That's a pretty interesting example of what stereotype threat is, right? So when my system feels like it might confirm a stereotype, it impacts how I perform. Sometimes positively, right? But most of the time it has a negative outcome. So, if I, as in this case, as the white person, feel like I'm not as good an athlete, it's going to make me perform worse. And what we find is it does. Here's another interesting one. Anytime you introduce a test that's of intellectual ability, same thing looking at white students and African American students or people, anytime you talk about a test and it being about intellectual ability, African Americans test takers do worse. Why? Because we have a stereotype, right, around intelligence and race, unfortunately, culturally. What's interesting is when you talk about learning outcomes and the process of learning, that goes away. You don't see the difference. If you don't make it about ability, intellectual ability, then the stereotype threat seems to negate itself. Women in math, I like this one, in math performance. As a former math major and math education and math teacher, two different interesting studies I found that if you give women or girls a math test and you say, if you acknowledge, right, that there are a lot of people that think that women don't do well on these tests as men, because that is the stereotype, right, in terms of math and a lot of the sciences. But this test, that is not true. When you tell women that, their performance is no different than men. If you say nothing on the same test, they score lower, right? That I don't always have to say something for that stereotype threat to occur because my system knows it already, right? Because I have the stereotype, sometimes by saying nothing, I accidentally create that stereotype threat performance problem. But I can negate it sometimes by just saying, you know what, this test was made for you. And by just saying that, I psychologically release, right, the threat, that perceived opportunity to confirm this negative stereotype, right? Now that's almost a nothing in terms of something to do. But to think of that if we could do things like that more often, we could help at least alleviate some of that. I think is really interesting. They also have found very similarly that looking at women and taking math tests, if the administrator is female, women score better. There is also a factor in stereotype threat about having some seeing somebody like you doing well or negating the stereotype also negates it for you. And so it's part of why I don't generally hear it talked about this way, but it's also why it's so important that folks see themselves on campus, right, and faculty and staff, not just so that they have a familiarity, but because it also helps negate stereotype threat. It also helps them see that that stereotype isn't true, because there are people, right, doing well in these places in these ways. So there are multiple reasons why representation matters, right, and why it's important that people can see themselves in faculty and staff on campus. Questions about any of that? All right. Connected to that, Richard Nesbitt has done a lot of work connected to stereotype threat, looking at what are called observer and actor perspectives, right, or theories. And it's interesting. A lot of this research happened around several of the folks who work on stereotype threat and diversity issues were getting asked to consult in institutions at colleges who were having lots of issues retaining marginalized student populations. Okay, those students were not doing well, and not so. I think it started in the 90s looking at students of color, then has evolved across time, right, to look at other populations who are marginalized. And part of what they found is that there was a big difference in what the observers at those institutions were interpreting potential problems and questions to be, and what the student or the actor themselves, right, was perceiving the problem to be. So I thought this was just interesting. As I read these things, I'm curious, I guess, as we go through them, if these are things you've heard people say on campus when we talk about the fact that some groups of our students struggle more than others. Okay. What they found is that observers often ask this question: are we admitting the right student? I don't know about you, I've heard that probably quite a lot in my more than a decade of being back in higher ed. Should we be weighing academic skills more heavily in admissions so that we know that everybody's academically prepared? Is family background important? We hear people say student lack motivation or cultural knowledge and skills to succeed. I've heard all of these things in my history of being back in higher ed. That they are self-destructing because of low expectations or low self-esteem. Has anybody not heard these things? I doubt it. I hope in one way nobody's heard them, but unfortunately I doubt it. And so they're looking at, right, is it we're just picking the wrong people, right? Is basically in essence what a lot of people want to talk about. And instead, when they really started looking at what was happening and looked at the students themselves, here's what they found: that students have been more affected by the ways campus life was organized than by the actual racism of a particular person. That how the campus culture itself was organized was a bigger factor than any one person doing something, right, or saying something to them. They also found that a student's sense of marginalization was a really significant factor, right, in their performance and ability and desire to stay enrolled, which again makes sense, I think, probably for most of us. And that those students talked a lot about campus culture and the ideas of who and what were cool, what the prevailing values, social norms, right, preferences, all those things were, and acknowledged that most of them were dominated by white culture. So in essence, right, what you have students saying, and I hear it still to this day, honestly, I don't think it's changed that much, is we don't fit, or where do we fit, in essence. And so students were worrying about belonging and whether they could find a valued place. Could they be valued for who they were when who they were didn't fit what was cool, right, or in or acceptable by whatever the culture was? That makes sense? And so what was really interesting time after time that these consultants would find and these researchers is that the institution was looking at it from one angle, right? But when you actually looked at it from a student point of view, it was a whole different problem. And so, we have to start looking at this from a student point of view and looking at what is the problem, right, from their point of view, if we're going to look at trying to mitigate and navigate these things. And that all of that contributes to this stereotype threat issue, because the more I feel like I don't belong or question that, the more pressure I may feel to mitigate a stereotype. And the pressure of that makes me perform worse. So there's some of the connection there. They also really would identify that there's a small number of faculty and staff who look like them in many of those instances. And again, belongingness is critical for lots of reasons, but I will also say this, what does it say to students who, when an institution has trouble retaining staff who look like them? You have that factor too, which then it doesn't mean it's already, which raises somebody to ask questions about the why, right? And also brings into doubt their levels of belonging or what went into, whatever it is that made that faculty person or staff person leave. Even if it had nothing to do with these issues, it doesn't actually matter, right? Because when there are so few folks who look like me and they start leaving, I start to feel insecure and wonder what that's about. Which again ramps up all of these issues, and especially stereotype threat. So given kind of some of that landscape and helping to start to understand what may be happening behind the scenes for folks that maybe we haven't thought about, what do we do, right? How do we act in an informed way? How do we act in a trauma-informed way? How do we act in a way that is really informed by what could be happening for students, especially who are experiencing potential marginalization or bias? And the first one, I talked about this early on, is creating a shared understanding, first for me, doing my own stuff, and having conversations with my colleagues, right, about these kinds of issues. It's education, primarily, as a first step. I have to understand what's happening, both for me and my department and the students that we serve. We need to always assume that trauma, and I would say marginalization, are in the room. The rates at which trauma occur in this country, if you've got more than 2 or 3 people in a room, trauma is present. If it's present, and we kind of have to remember that in how we speak, because sometimes we speak in ways that it's not present, and we accidentally send some messages that are not good or helpful or that we don't mean to send. I think very similarly, we have the same issue for marginalization. We think we know everybody's identity from looking at them, and the reality is we do not. And the reality is we need to assume that it is in the room, right? And we need to be proactive about understanding that and not just reacting when we've hurt somebody's feelings, right, or something happens. We've got to, as we look at again, look at our own implicit bias. We have to look at ways that our systems and structures place an undue burden on some students or that accidentally encourage stereotype threat, right? We talk a lot, at the counseling center, like looking at our policies and procedures, and are we creating barriers for entrance, right? Are we making it harder than we should for somebody to access service, and we're looking at who is accessing service, right? Are we seeing any areas or groups of students that aren't accessing us? And are we then doing what we need to do to figure out why? Is it a systemic problem? Is it there are people they don't see that look like them? Is there something else, right? Are we trying to understand why we're not being accessed sometimes? And are we really willing to analyze how we do what we do from a marginalization and stereotype threat kind of lens so that we can make sure that we're not perpetuating any of that? I would hope this goes without saying, but I actually know it doesn't, right? We've got to be able to support all students to feel safe in all aspects. Understanding that I cannot guarantee safety, right? We don't get to control everything that happens around us. We don't get to control everybody in our classrooms. I can do a whole lot, and that does not stop somebody from saying something that is really, hurtful or damaging to somebody else. So it's not a guarantee of safety, but really it is making it clear that what we are wanting to provide, right, is we are wanting to create as safe an environment as we can. And there's a lot we can do to do that for folks. I do think it's important to not always say to somebody, you are safe here, when you're talking to somebody who's in a marginalized identity that's not yours, because you can't guarantee you're not going to mess that up a little. I can guarantee I'm going to do the best I can, and I'm going to guarantee I want to create as safe an environment for you as I can, and that I want you to tell me, right, if you're feeling like that's not the case. But I'm not going to promise you something I'm not sure I can completely deliver on either, because that seems that, I have worked with lots of students who are really sensitive to that kind of language, because they kind of know in their world it's not true, right, that we can't guarantee those things in some ways. Are we assessing student needs in a really holistic way? Again, taking into account some of these marginalized issues and concerns, not always assuming that their lack of performance is due to some character flaw, right? But seeing that lack of performance as potentially a symptom of something happening. Part of it is also, and we talk about this a lot in the Division of Student Affairs. I'm sure that the academic affairs side talks about this as well, and we try to work across between the two, but really creating some shared responsibility and teamwork, right, of wrapping around students, and are we working collectively together to accomplish these things instead of in our silos. Always being ready and willing to adapt to their ever-changing needs and the feedback we receive, and being attentive to that feedback, creating a culture that makes it clear that diversity is valued, and finding ways of living that, right? And not just being words, but finding ways of living that. That's extremely important in multiple ways, but is one of the factors that also eliminates stereotype threat. In particular to stereotype threat, here are just a few others that actually I think are very related also to issues of trauma and also other types of marginalization. But we can remove cues that trigger worries about stereotypes. We can be careful how we talk about tests. We can be and evaluations. We can be intentional about talking about how, as a professor, I can go into a class saying, this is a class that all of you can succeed in. I can be intentional about saying that. That starts to send a message, right? That this class is made for you. This class is built for you. We have a lot of students, I know I talked about this in the last session, who aren't even sure they're made for college, right? They're not even sure they're up for it. They're giving this a try, in essence, which is why sometimes when it starts to get hard, they interpret that as, oh, I'm not built for this. And by saying, I say this to new incoming students all the time, you're here, which means you were made for this. It means we know you can do this. So set that thought out of your mind, right? That you are capable of this. And this stuff's made for you, right? It doesn't mean you're not going to struggle, because struggle is a part of it. You can't learn anything without some struggle. So normalizing struggle and really trying to remove any cues, right, that would imply or accidentally, enact a stereotype. Creating critical mass, continuing to try to create environments and faculty and staff that look like our students, right? Can we get closer to proportionate between our student body and our faculty and staff of what those demographic makeups are? Because the less I feel alone, the less likely a stereotype threat's going to get triggered, right? And the more alone and isolated and other I feel, the way more likely that is to get pulled into place. Really making sure we're creating fair assessments and presenting them as serving a learning purpose, not a measure of innate ability or intelligence. It's a huge one in the literature. If you look at stereotype threat, we're assessing what we're learning. We're not assessing how smart you are, right? Because intelligence triggers stereotype threat in a much more severe way. Making sure we're valuing individuality, trying to, anytime we can, improve cross-group interactions and how we, navigate our classrooms and how we dialogue with each other. Again, recruiting and retaining positive role models from diverse groups. It increases sense of belonging and helps negate the negative stereotype. Helping students manage feelings of stress and threat. Maybe it's coming later. Part of what what it is acknowledging it exists, even at times for students, so that they even recognize it. Because for lots of students, it's subconscious. They may be feeling anxious, but they're not recognizing that's what it is, right? They're not recognizing that it's because of that. And so teaching about it helps them to attribute the anxiety to the threat rather than risk than failure, which means, oh, if it's just that, I can ignore that, right? Because that's not actually real. That's just a stereotype that my system's trying to buy into, and that helps folks negate it as well. Reinforcing that worries about belonging are normal and not unique to them or their group, right? I mean, anytime we can normalize some of those feelings and acknowledge, yep, that makes a lot of sense why you're feeling that way. It can help negate some of the threat risk. Promoting a growth mindset about intelligence. This is critical. Teaching students that intelligence is like a muscle, right? That it grows with effort. That is a huge factor in mitigating stereotype threat and helping, level the playing field on performance for marginalized folks. And so we talk about growth mindset a lot in higher ed, but making sure we're talking to students about it, it's not like you're either smart or you're not smart, right? I mean, that's a lot of what college success is about learning how to do college. And, learning is a process, and you can get better at that. That's a lot of it here. Questions on any of that? Or thoughts? Okay. I know some folks have popped into the chat. They had to go to meetings or other things. So I think, the other last piece, and I showed this at the last presentation too, is part of it is recognizing what we can control about all this. So, I can work on me and all these issues. I can also have conversations with people in my circles, right, about all these issues. And I can raise people's awareness, and I can, choose when I speak up and when I don't, that I can control me. And the reality is, if all of us did that, that's how you change culture, right? That's how you change a campus culture, is the ripple effect of a bunch of people starting to do them differently, right? Which influences other people to do them differently. And then that ripple is what starts to change culture. And so really, I think it's easy to get really discouraged when we talk about issues of trauma and marginalization and bias, because it feels like these are things that are just never going to end. And I don't know, maybe they won't. I have conversations with friends of mine, and we often say, what are the odds of this ending in our lifetime? I don't know that it's going to end. But it doesn't mean we can't control our sphere, right? We can't change culture in a place, in my office, in my classroom, in my department. It doesn't mean that we can't give people a different experience than the greater world does. And I would say that the more each of us tries to do that, the greater chance we have of changing the larger kind of cultural sphere. And so it's not getting discouraged by that piece of it. It's realizing, every student I make feel safer, right? Every student who I'm able to help understand that they can succeed, right? Every student I can do that to is a lot, right? That's success for us. And we're just stringing, the more of those we string together, and the more of us that are in the fight to do that, that's how we get to a greater campus culture kind of change. And so, that's not easy some days. Let me say, I'll say that for myself. But know that there are great resources out there. There are a lot of great folks on campus who are working on these things too, and who work on, there's a lot of great literature out there. One of the books I really love is called Whistling Vivaldi. It's by Claude Steele. It's all about stereotype threat and academic environments. It's really interesting to look at some of those. There's a lot of great books on privilege, right? And on how we kind of understand ourselves and where we're getting it right and where we're missing it, in terms of how we see and navigate. Even Bridges Out of Poverty, I think, is a great one. there are we need to be really alert and examining, right, the implicit bias we have, not just on race and gender and sexual identity, but on economics, right, economic justice issues, and a whole host of other things that come in, and stop always assuming when students aren't doing well is that we're just bringing in the wrong student, right? That our first, because we actually, let's look at first, what is it that's happening in my sphere that I can control that maybe needs to change, right? And talking and communicating with these students and trying to figure out what's happening. And that ties right back into, the piece of seeing students struggling as symptom, not as, they don't care or they don't want to do or they don't or whatever, because it is very rarely that. It is very rare that I've ever worked with a student who said, yeah, I'd like to fail, please. But that is not what students want to do. They may not know how to succeed, right? Or they may not even be sure they're capable of it, but they don't want to fail. And so the ways in which we engage them, right, and create supports around them as an institution can help negate some of that and help them realize they are capable and that this is something they can learn how to do, even if they don't know right now how to navigate that. So those are just some thoughts. From a reporting standpoint, though, on the bias stuff, so to get back to one of the early questions, it's important to recognize there's a bias response team. Comes out of, I think, the Data Students Office. Very similar to Title IX reporting, right? Sexual violence reporting. The bias is part of Title IX. And so I think that, we have kind of split those into kind of two different areas, but the bias response team exists. I know that Christy, Data Students, is on it. There are some folks from the Institute that are there and others. There's a small team of folks I know that gets together on a regular basis and looks at bias incidents that get reported, and investigate those and move forward. I know that there's a great commitment from that team and out of that office and Dean of Students Office to make sure the students are feeling safe, and that we are treating folks with dignity and respect, and getting rid of these implicit biases and whether that's conscious or overt that are happening to people out there. And so if you know of things that are happening, clearly, right, part of what we do is if somebody in my sphere is saying or doing something that is not okay, I'm having conversations with them about it when I can, right? So we influence it in that way. But there are lots of times it's important to report it to the bias response team and to encourage students to report things there. Sometimes little things. I mean, what I would say too is, right, if it's impacting my ability to live and learn, it's okay to let somebody know that, because what we never know is how many other people are experiencing that same thing, right? And so sometimes it's a bunch of little reports that actually turns into something bigger that's more actionable. Sometimes it's some things that I say little, I mean in a perception way, right? Things that some people think are not as significant in others, that show a systemic problem that we need to deal with, right? That we'll never know if we're not making sure folks understand what students and faculty and staff are experiencing. So to me, it's just really important to make sure to use that reporting system and to make sure that students are accessing that when they're struggling, or if you're seeing things as well. Did that answer your reporting question, kind of connected to Title IX? Okay. Other thoughts and questions as we get close to wrapping up here again? Thanks to the couple of you who have stuck in.
Thank you so much. This was all so helpful and such a great topic to present on. Thank you.
Thanks for that. Really know that if you or your area, I think I've said this every time, wants to have more discussions, right, or know a little more or understand a little more about any of these issues, really don't hesitate to let me know. I'm more than happy to come in and have conversations, or even talk about just a strategy of some ongoing things, right, and ways of starting to address these or any other mental health or something in my area, this kind of consultation is something that I think is really core to what I do. In my role here as the director of the center. And so don't ever hesitate. It's never a bother. These are things I probably enjoy doing more than lots of other things I do in my job, even though I love most of them. So really feel free to reach out if there's any ways I can be helpful. And I'm going to thank you greatly. And I'm going to wait one more time for any more questions before we sign off. Okay. Well, again, thanks. Have a great rest of your Friday afternoon and a great weekend. And thanks to you all for having me. I'm in the first place for all three of these, actually. So I really appreciate it. And take care.
Thank you.
Thank you. Take care.
Yep. Talk to you soon.